James Zanewicz of Connect here at the BLPN during JPM Healthcare Week, and it's my pleasure to be sitting down once again with Howison Schroeder. Welcome back.
Well, thank you. Pleasure to be here.
So great to have you here, and as you know, the Bullpen has actually really aggressively branded themselves in a smart way now as building legendary professional networks. And as a legendary professional, I'm excited to have you here. I'm excited for the BLPN community to get to know you a little more, and we have a lot of new members, so tell us a bit about your journey and how you got to where you are today.
Well, I'm from Pittsburgh, and in Pittsburgh we have Heinz Foods and Heinz 57 varieties. We use that term to describe someone who's a mutt. So I am multi-different species. I've been a professional geologist. I have a degree in history. I have a degree in economics. I worked for JP Morgan. I've spent now the last 30 years in the neurosciences. Mm-hmm. And what else should I add to that?
How'd you find out there? Yeah.
And I'm now actually CEO and co-founder of Neuro-Innovators. And what we are doing, we are repurposing 3 drugs to be used together to promote enhanced neuroplasticity in the brain. And our target indication are those with chronic stroke motor deficits. Huge unmet need. And we've gotten here because basically most of my 30 years in the neurosciences has been spent developing what to this day looks to still be the most sensitive neurofunctional measurement tool. And I was always surprised why the drug companies weren't putting more into that, because one of the biggest causes of failure for no drugs is they don't have an appropriate objective outcome measure. One of the patents we also filed, the technology was eye tracking, and we found that when you did these tests frequently, they became exercises. So years ago, we filed a patent to include any drug that promoted neuroplasticity with the device. That patent was issued last year with few claims. Yes, thank you. We don't own that patent, but that became the foundation of what we're doing now. So we've got 3 patents filed here, and we've got an IRB in place to start our first in-human study at Mass General Brigham Spalding Rehab Hospital. And we're looking for money.
Nice. So what are you excited about what you're working on now with that? Like what aspect of that makes you want to get up and do things every day?
You know, it is, the neurospace is how do I say this? The neurospace is just such an unexplored territory right now. And our pharmaceutical technology has been very geared towards all our other organs, our heart, our lungs, our livers, and those organs each have a very fixed operational set. And to help us cure things within those organs we've been hugely successful with new single molecules that address generally very narrow mechanisms of action. Right. That does not work in the brain. The brain is too highly adaptive. And it really is exciting to be at the leading edge of doing this. Nobody's really looking at the world. They're starting to look at the world this way, but I wouldn't say very many are commercially looking at the world this way. Right. And being able to help 7 million stroke survivors in this country. Stroke is now the largest cause of long-term disability in the world because we're good at keeping them alive. Being able to help all those people is a fabulously rewarding feeling.
Nice. And you said you're looking for money right now, so what kind of round are you doing, or what are you looking for?
This is a Series Seed round, a Series Seed preferred we have. We did a preferred to make sure we would be eligible for the qualified small business. It's a $3 million preferred, and in this very challenging money-raising market, we've taken it and broken it down into pieces, trying to match the key milestones that were in front of us. So each is $1.5 million. We've raised half of that first $1.5 million. We need another $750 to get our first 10 subjects at Spalding. And then we have our own data, then we cross sort of a whole nother risk profile Rubicon.
Got it. And so, as you know, the BLPN is all about helping others, but this is the moment where you get to make your ask and how the BLPN members can help you. So what can they do to help you right now?
I'd like to start by just saying I've been a founding member since the very, very, very beginning.
You and I go way back.
Yeah, exactly. Back was a little more affordable to join, too. And I have to say, this is, with all the organizations that we all, I'm sure, interface with from time to time, the ethos here is so much, it's just so much better. The helpfulness, and I'm happy I've got years, decades of experience in finance and medical devices, et cetera. Happy to help anybody who's got any questions, just as a sounding board, whatever it might be. For us right now, there's always a need for expertise, but at the moment, we just need to get this clinical study started. We're looking for connections to get family offices, individuals, whatever it might be. We're actually looking at the crowdfunding thing, which has been a huge education that the bullpen has made very available to get our 750 and or more to get this study underway.
That's incredible. And so if someone thinks they can help you or has a need for help that you could help with, what's the best way for them to get in touch with you?
Reach out. My email is h.schroeder, Schroeder, just like peanuts.
Exactly.
I'm not as good on the piano, though.
Yeah, like on the piano. It's like easy.
At 𝗪𝗏𝗪𝗀𝗻�innovators.com.
Easy, 𝗪𝗏𝗪�innovators.com. And so I always tell folks this, that when they reach out, they should include a note and not just like request you on LinkedIn, if they're going to do LinkedIn as well, or an email, like something to let you know, like, hey, they've watched this, they understand what you're about. Is there a little fun fact or a code word or something they can throw in there that'll let you know, like, oh, they actually know about me because they watched the whole video.
Let's see. Do they know that Christian likes to go to comedy clubs in Boston?
Ooh, I like this. There's a Christian comedy, and that's
Christian
it, right?
comedy. There you go. Christian comedy.
I love that. That's great. Well, Howison, thank you so much again for sitting with us, for taking time.
Thank you for having me.
I know you're networking like crazy. We appreciate you sitting down with us, and I hope the BLPN members can actually reach out and help you as much as you've helped other people.
Yeah, absolutely. I'm more than happy. There's a lot of scar tissue here, and this is not a space for the uninformed. Tap into any mentors you can find when you can.
Absolutely not. Thanks again. Appreciate you.